Yeah, I feel completely back to myself. So I feel really lucky. I mean, I'm still having low grade fevers pretty much every day. But other than that, I have good energy and all my other symptoms have gone away. My husband today is much better, but he kind of had a second cycle of symptoms and ended up getting much sicker than he was the first time. So that was pretty scary. Yeah. Yeah, so we got back on a Sunday, and Monday I didn't feel right. I was tired. I had some muscle aches, which I mean, you could attribute to jet lag, but with everything going on, it just didn't feel right to go to work. So I had told my work that I'm just going to do a 14-day quarantine. And I'm lucky that they understood and I had the luxury to do that. I don't think many people can just like take time off. So that was nice. And then I ended up getting much, much worse with like sustained high fevers. I could barely get out of bed. My muscle aches were like nothing I had ever experienced. And I've had the flu before. It is nothing like that. Um, so I ended up getting tested 2 days later, and then it took over 8 days to get my results back. So we both are lucky enough we were able to stay home and that we could treat our symptoms at home. We only took Tylenol, but other people aren't so lucky; they get much sicker. So he's doing better today. So we both kind of got better by day 7. I continued to get better. And then after 2 days, Sebastian got more sick than he was initially. So he had a sustained fever of 104 for 2 days straight. He couldn't like get out of bed. He slept all day. He has a really, really bad productive cough and sore throat, muscle aches. You have this constant headache. It just kind of takes over your whole body. I did, yes. So my workplace isn't offering testing for any employees. I had to call 4 different physicians, primary care physicians, for someone to even take a chance on me. Nobody would even let me talk to the front desk. I called the health department. No one, you couldn't get through. And then the drive-through centers weren't open yet. So one physician ended up like feeling bad for me and taking a chance on me, and he created a testing center in the parking garage of the office building, and they came out and tested me, which I'm really grateful for. So the CDC recommendations, there's 2 different pathways you can go down. One is that you can return after your symptoms have resolved, basically greater than 10 days. And then another is you should test negative once or twice before returning to work. So my workplace and Sebastian's workplace have both asked us to test negative before we go back. It's no one knows when the virus leaves your body, so I'm not sure when I'm going to go back. I feel great. I might try to get retested again this week if I can get an appointment at the like the drive-through centers or another physician. I'm not sure. Is a physician. Mhm. Absolutely. So when we went through all of this, I was watching CNN and the local news and just everyone sharing their stories, and everyone's story was a little different. And I just felt like our story is unique and different as well. And that if one person could relate to it, if it could encourage one person to stay home, it's worth sharing. So I did, and I'm glad I did because I have so many people reaching out to us asking about their symptoms or what they should do. And it seems like I've gotten the message across that you should stay home, self quarantine, protect yourself, protect your family, protect your community. You have people every day on so many different levels risking their lives to help all of us that the least we can do is stay home and help protect them as well. Absolutely. Absolutely. That's how it was when we were really in the thick of it. Every day it was anxiety producing because you didn't know what the next day was going to bring. So I really emphasize that I think the psychological toll, for anyone, someone sick or healthy, is just as, terrible as the physical toll that it puts on your body because I was just waiting for the day I had to go to the hospital, waiting for the day I couldn't breathe. And you never knew like what the next day brought. And then especially being like healthcare providers, we all reach to like evidence-based practice and case studies, and there are none because everyone's trying to figure this out. So you really have no guidance as to how to how to create the best circumstance for yourself. You're kind of just at the will of this disease. Exactly. I cannot emphasize that more to everyone. I mean, Sebastian and I are 30 and 31. We're healthy, active, we're healthcare professionals. I feel like we had every tool to prevent getting sick. And if we got sick, to lessen the symptoms. And we were bedridden for over a week, extremely ill. So this doesn't, no one is invincible to this. Anyone can get it, and the every day more cases are being reported of children, adolescents, young adults, older adults that are getting really really sick. So I think the best thing you can do is stay home. Minimize all non-essential travel, leaving your house.